Hi everyone, and Professor Bhaskaran, it's Rachel again with another video blog, and this week it's about EHR risks. Why are EHRs implemented? Because they have many benefits, but like our previous discussions about electronic PHI, electronic health records, or EHRs can run into many risks. Many health facilities take the many benefits of EHRs, such as better access to data, improved quality of care, reduced drug interactions, and less storage space into account, but they sometimes don't take the risk into account as seriously because the facility believes the benefits outweigh the disadvantages. Patient privacy. Privacy is defined as to be let alone by Justice Samuel Dennis Warren and Justice Louise Brandeis. Data should only be exchanged with the patient's information, so if it isn't, this is considered a HIPAA violation as well. Only authorized personnel should be able to access data, but they should only use the data for their job and not for misuse or personal use, such as being nosy and looking up a patient's diagnosis when you don't have that patient or something like that. And I thought this picture was funny. EHR risks. Risks to EHR include previous breaches that we discussed earlier on, such as hackers, misuse of EHR, and even hospital staff using patient data for their own personal gain. An example of this occurred at Howard University Hospital in May of 2013. Lori Napper used her position as a medical technician to access patients' names, addresses, and Medicare numbers. She sold this information over the period of time that she worked, and that was 17 months. Over 34,000 patients' data was compromised. She only served 6 months in a halfway house and was fined $2,100. And in my opinion, that's not a high. That's not like a high payment, or I don't feel like that punishment was enough because she could have ruined a lot of people's lives, and we don't know what the people who got the information that she sold did with the patient's information and things like that. So the patient's lives could have been ruined, their identity stolen, or they could have been using their Medicare numbers, things like that. How to fix these risks. Things that can mitigate risks include antivirus and malware software, things like firewalls, making sure that passwords are strong and not shared with coworkers, logging off the computer when you step away for a period of time. An audit or a random audit could have stopped this and even solved the previous example of Lori. An audit can see what kind of data is being accessed by who, for how long, and what screens were opened. This audit could have possibly stopped Lori in the act sooner, but the audit could also help investigate this as well, because the workers could see what screen she had access to, how long she had access to, if she possibly sent the information to somewhere else, if she emailed it to herself, things like that. How does EHR work with the risk information system? They work hand in hand with each other. The risk information system brainstorms the risk of an EHR and rates them on a risk assessment table. And they can rate things like cost and time, scope, and quality. Sometimes a risk register is used to control risk. An example is the risk manager may find that the staff was not trained properly on how to work the EHR system, so additional training is provided. And you can see here that I provided an example that I found of a risk register, and they rate risks from low to medium to high, low in green, medium in yellow, red, high in red. And an example is a risk description. Project purpose and need is not well defined, and the likelihood of this occurring is medium, and the impact it would have is a high impact, or the project schedule is not clearly defined or understood, and this has a low likelihood of occurring, but if it does occur, it would have a medium impact on the facility. And you can see things here like the severity, who would manage the risk, and what type of actions would help mitigate the risk in this column. And these are my citations, and thank you so much. Hope you enjoyed.